What we did then, so we established our Dutch nationwide PABC cohort, and we saw this aggressive histopathology and the worst prognosis for PABC. And one of the factors which has been associated with the worst prognosis in the past in literature was actually intra-tumoral hypoxia. So it is known from the general breast cancer population that hypoxia has a unfavorable prognosis when intratumoral hypoxia is present, but it has never been studied within PABC. So that was the reason that we investigated this and actually tried to find how often does this occur in the PABC population. And what we saw was that about 78% of the PABC patients had at least some extent of hypoxia within their tumors. Because for this we looked at the tumors of 195 PABC patients, of whom 150 were pregnant and 45 were within 1 year postpartum. And we looked at the expression of several hypoxia-associated proteins, which were HIF1-alpha, GLUT1 and CA9. And when we looked at the patients who had at least expression of one of these proteins, that was 78%. So a big majority of patients who had at least one indicator of hypoxia in their tissues, and that's about double of what we know from the general non-pregnant but also young breast cancer population. So that is indicative of a more aggressive histopathology, because that is mainly the correlation that we see that especially the patients with more aggressive histopathology are more prone to also have intratumoral hypoxia. So when we then compared within our PABC cohort the 78% with hypoxia compared to the 22% without hypoxia, we also saw a worse overall survival for the patients with hypoxia, which was 70% after 5 years compared to 90% for the patients without hypoxia. So yeah, that goes along with the aggressive histopathology, but it's very common in PABC.